Welcome to Lesson 8 of the Zambia Institute of Sport, TVETA, and National Sports Council of Zambia accredited Sport First Aid course looking at major injuries and medical conditions. These medical problems can range from very minor to life-threatening emergencies, and first aiders must be prepared to respond appropriately as they could be debilitating or even life-threatening if not treated quickly. This lesson is expected to achieve effective first aid management of the following major injuries and medical conditions that may affect athletes: diabetes mellitus, epilepsy, head injury, and heart attack. In most cases, a diabetic emergency occurs when the casualty's blood sugar levels have become too low, a condition called hypoglycemia, often due to missing a meal or over-exercising, which, if left untreated, can become very serious. It is important that any such conditions in your athletes are known beforehand so that the first aider can plan for it and have essential medication on standby, in addition to whatever the athlete themselves may also have, for example, insulin or glucose tablets. Signs and symptoms of hypoglycemia can include feeling hungry, sweating, dizziness, tiredness or fatigue, blurred vision, trembling or shakiness, going pale, fast pulse or palpitations. If the casualty who has just suffered a hypoglycemic attack is conscious, the first aider should give them a sugary drink like lemonade, orange juice, or even a glass of water with at least 2 teaspoons of sugar in it to help raise their blood sugar levels. Never give them diet drinks, which are very low or no sugar at all in them. If the casualty is fully conscious, suggest they have a sandwich or piece of fruit, even if someone appears to have recovered. Ensure they receive urgent medical advice. This is particularly important at night, as insulin will be active in the bloodstream while they are asleep, and the blood sugar levels will therefore drop again, and they could drift from sleeping to unconsciousness. Call for an ambulance. If the person is unconscious, place him or her on their side in the recovery position and check the airway, breathing, and pulse. Do not attempt to give an unconscious casualty anything to eat or drink, and never give them insulin, as this will further lower their blood sugar and could kill them. Even if someone appears to have recovered, ensure they receive urgent medical advice. This is particularly important at night, as insulin will still be active in the bloodstream while they are asleep, and the blood sugar levels will therefore drop again, and they could drift from sleeping to unconsciousness. Call for an ambulance. Though hyperglycemia is less common than hypoglycemia, it is still a very serious diabetic condition, manifested through an abnormally high blood sugar level, leading to an increase in frequency and volume of urination. Look out for fruity smelling breath, nausea and vomiting, shortness of breath, and excessive hunger and a thirst in suspected patients. Treatment to lower the blood sugar level in our casualty to a normal range is mainly through plain water and any other non-sugary drinks, including pure unsweetened milk. The fluids replace those lost through excessive urination, as well as help dilute the excess sugar in the blood. Avoid caffeinated drinks, alcohol, regular soda pop, fruit juice, and other liquids that contain a lot of sugar. As your blood chemistry returns to normal, your doctor will consider what may have triggered the severe hyperglycemia, and depending on the circumstances, you may need additional evaluation and treatment. Call for an ambulance. Epilepsy is a central nervous system neurological disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Anyone can develop epilepsy, which affects both males and females of all races, ethnic backgrounds, and ages. There are 2 recognized types of seizures: a major seizure, also known as a generalized tonic-clonic seizure, caused by abnormal electric activity throughout the brain, and a minor absence seizure, which is less severe and only affects a small portion of the brain. Though there is no cure for epilepsy, treatment with medication and sometimes surgery can control seizures for the majority of people. Some people require lifelong treatment to control seizures, but for others, the seizures eventually go away, while some children with epilepsy may eventually outgrow the condition with age. Having a single seizure doesn't mean you have epilepsy. At least 2 seizures without a known trigger, that is, unprovoked seizures that happen at least 24 hours apart, are generally required for an epilepsy diagnosis. Because epilepsy is caused by abnormal activity in the brain, seizures can affect any process your brain coordinates. Seizure signs and symptoms may include temporary confusion, a staring spell, stiff muscles, uncontrollable jerking movements of arms and legs, loss of consciousness or awareness, psychological symptoms such as fear, anxiety, and déjà vu. Symptoms vary depending on the type of seizure, though in most cases, a person with epilepsy will tend to have the same type of seizure each time, so the symptoms will be similar from episode to episode. Doctors generally classify seizures as either focal or generalized, based on how and where the abnormal brain activity begins. When a person is having an epileptic seizure, never do the following to them. Never put anything in the casualty's mouth. Never give the casualty anything to eat or drink. Don't try to move the person. Don't try to restrain the person. Remember to remain calm while attending to the casualty. If the casualty is having a tonic-clonic seizure, which causes uncontrollable shaking or jerking, ease them to the ground, turn them gently onto their side into the recovery position to help them breathe. Clear any dangerous objects away from them. Put something soft under their head. If they wear glasses, remove them. Loosen any clothing such as a tie that may affect breathing. Time the seizure and call for an ambulance if it lasts longer than 5 minutes. Potential complications resulting from epilepsy include about 20% of people with epilepsy have an intellectual disability, injury from falling during a seizure, injury while operating a vehicle or machinery, depression, brain damage from prolonged and uncontrolled seizures, choking on food or saliva, medication side effects. Each year, nearly 2 out of every 1,000 people with epilepsy experience sudden, unexpected death in epilepsy, or SUDEP. According to the CDC, SUDEP is an epilepsy-related death not caused by drowning, injury, or another known cause, with pauses in breathing, airway obstruction, and abnormal heart rhythm thought to contribute. Call for an ambulance if the casualty falls unconscious and doesn't regain consciousness within 10 minutes, or seizures last longer than 5 minutes. A head injury is any sort of injury to your brain, skull, or scalp, and can range from a mild bump or bruise to a traumatic brain injury. Common head injuries include concussions, skull fractures, and scalp wounds, with consequences and treatments varying greatly depending on what caused your head injury and how severe it is. It can be hard to assess how serious a head injury is just by looking, as some minor head injuries bleed a lot, while some major injuries don't bleed at all. It's important, however, to treat all head injuries seriously and get them assessed by a doctor. Lesson 8A discussed 2 conditions that may affect athletes, namely diabetes mellitus and epilepsy, and that the first aider is expected to achieve effective first aid management of. Even though affected athletes are often able to compete effectively, the 2 conditions can flare up at any time and call for prior knowledge and preparation by any first aiders during practice or while covering their matches. For further information, refer to pages 125 to 138 in the first aid manual. Also, visit the following links given at the bottom of the slide.